and want to thank you all for joining us today. I'm going to turn it over to Dr. Durham, who's going to walk through the provider update slides and kick off the meeting. Dr. Durham.
All right, thank you. And thanks everyone for joining. It's been an incredibly busy week with a lot of updates, and the FDA Advisory Committee is meeting as we speak about the kid doses. So, the fun continues. And I think probably, I can't see if Dan's on the call, Dan Burke, but will be joining us. We also have Joelle Jacobs, who's our, really in charge of our allocations and ordering for the state. And so she'll chime in on the end as well. So as always, this is our updated DOH mission with emphasis on equitable access to services, improving health status, working with partners and ensuring safety. And just a general overview of the state. I think, if you're listening to the news, you've kind of got the picture that our Delta surge is plateaued. It really hasn't, it hasn't gone down as we've hoped. And one of the things that's happening, I think, is people are a little bit sick of testing, is that our positivity rate is going up. So the positivity rate, these are just from the CDC, is the orange line, and the red line is our cases. This is from COVID Act Now, one of my other favorite data tracking websites. The infection rate, or the R value, the R effective is 1.05, so we're not down below 1 yet. Getting below 1 means then that there's sort of hope that the cases start to decrease. This is, on the bright side, our vaccine administration by week. Sorry, it's kind of a funky, I don't know what happened to the slide in translation, but kind of, you can see a little bit of a bump here as we've started to give boosters. So this is total doses administered. Our primary doses, have been kind of puttering along. And while I think our regional director in the Southeast reported that they thought they were actually seeing an uptick in primary doses with all this booster activity, but across the state, that isn't the case. Here's just our numbers from the dashboard vaccine progress update. So we're almost at 82% of New Mexicans with at least 1 dose, and 72% fully vaxxed. This 8% of New Mexicans receiving a booster, again, using not the denominator of people who are eligible for a booster, but just the whole 18 plus population. Okay, so booster dose administration in New Mexico. This is just a quick look. We've done 125,843 booster doses and additional doses. We don't have a way of separating those out in NMSIS, so it's just kind of anyone who's gotten that extra, additional, or booster dose. And this is just comparing Moderna and Pfizer, and you can just see in this green box the 3rd dose of Pfizer, obviously a lot more than Moderna, because Moderna just got approved. So here's our booster update. So basically the ACIP last week met on the to basically issue the sort of clinical guidelines around FDA's authorization of both the Moderna and Janssen boosters. So for Moderna, and I know none of this is new to any of you, but it is the half dose or 50 microgram COVID booster. The timing is 6 months after the completed primary series. Just saying it one more time, it's a half dose. And the eligible group is same as for the Pfizer, 65 plus, anyone 65 plus, anyone 18 to 64 at high risk of severe COVID-19. So that's really looking more at the medical conditions, and 18 to 64 with heightened job and institutional exposure. Oops, sorry, that has them at a higher risk of COVID. So the CDC website is still kind of putting people into the shoulds and mays. So the should group are the highest risk, or the 65 plus, and people who are 50 to 64 with medical conditions. We had sort of split those out in terms of scheduling, and at this point, you know, we don't have that. Anyone can schedule for a booster who wants, but of course, paying attention to our most at-risk people makes sense. For the J&J boosters, also authorized last week, the timing is 2 months after the completed primary vaccine. It's a full dose. It really almost seems like a 2-dose series, but it's being called a booster just to try to simplify what is getting to be an increasingly complex landscape. The eligible group is everyone 18 plus who got a J&J primary vaccine. So basically, and these are all in the should group on the CDC website. So, and you know, I think that is a nod to the fact that the J&J hasn't had the same efficacy, the 1 dose. So really looking at trying to get people who got a J&J primary a second vaccine. Mix and match boosters, something we all were waiting for. Now, you know, like, is it going to make it easier or harder? But I think overall, operationally, we will get used to this and it will make it easier. But the key thing is the eligibility and intervals follow the primary series booster recommendation. And then the actual booster dose and volume are the same, whether it's same brand or mix and match. And then the last thing is that the mix and match really applied to the boosters in the authorization. And this quote is from the CDC website: in general, primary series and additional doses, so for immunocompromised people, should be with the same vaccine product. But the language is definitely softening, I think, the kind of in general. So just to give an example, you know, if I started with J&J, then in 2 months, I'd be eligible for a booster, and my choices would be another J&J, a full dose Pfizer, or a half dose Moderna. And if I started with Moderna and I fell into that group of high-risk people, 65 plus, or medical or 18 to 64 with a medical condition, or 18 to 64 with a high-risk living situation or occupation, then in 6 months, I would have a choice of booster, and it would be that same choice: a full dose Janssen, a full dose Pfizer, or a half dose Moderna. Okay, sorry if I'm belaboring the point here. So a few other updates. Revaccination is something that showed up on the CDC website. Oops, sorry about that. Yikes. And again, I would just encourage you, I've got the link to my favorite CDC page, which is the interim clinical considerations for use of COVID-19 vaccine. And that has all of this in detail, but I just want to say it out loud to have it kind of on your radar, that these kind of oddball situations that have come up for all of us at vaccine sites, and there hasn't necessarily been guidance about it. Now there is. So revaccination is a very niche situation, but if someone had a primary series that preceded a stem cell transplant, so basically all their cells got wiped out, they qualify for a revaccination, full series, 2-dose series. The 4th doses, so again, for people who are immune compromised and got a 3rd dose for, as part of that additional dose, then 6 months after that additional dose, they do now qualify for, what would be a 4th dose. So basically a booster after an expanded primary series. That's how I'm thinking about it. And it makes sense clinically, but it wasn't there before. In fact, it used to say exactly the opposite. No 4th doses were approved. Fully vaccinated hasn't actually changed. It's still defined by completion of a primary series, so that's good. And then one other thing that I thought stood out to me was the primary series where a second dose was given too soon. So that means with, sooner than that 4-day grace period that they gave us, there is a recommendation now to repeat that second dose. And to do it, 21 days if it's Pfizer from when the too soon dose was given, or 28 days if it's Moderna. And again, I'll explain better than I'm explaining it here on the CDC website, but mostly just saying it out loud so that, if it comes up, you think this is the place to go, or give us a call. But this is the page where they just updated it yesterday with all these new clinical considerations. Okay, 5 to 11-year-olds, we've talked that these are all kind of repeats. And like I said, we'll know more next week. But again, it will be a third of the Pfizer will be a third of the adult dose. It'll be 10 doses per vial. We're expecting approval for 10-week refrigerator storage and 100 dose ordering starting November 9th. The initial orders were all a 300 dose minimum. So just out of interest, our state got 66,000 doses of pediatric Pfizer as our initial allocation. They did have a 300 dose minimum order. We've submitted, we were supposed to order in basically 3 waves of 20,000 doses each. Joelle has probably spoken or reached out to many of you to get orders, and we did place all 3 of those orders. And this is just a plea from the immunization team to just really make sure that your information is up to date, because with in NMSIS, all the changes that are coming, this is really how the immunization team reaches out to you about orders and updates and all the rest. These are when we're expecting vaccine in the state. So we'll have a lot on the ground. We can do redistribution if someone, missed the boat and needs doses. Federal pharmacy partners and IHS will be allocated federal doses. So that'll be some extra doses in the state. FQHCs, I think we've talked about, really should order through the state. There's a very small number of doses in the federal FQHC program. Ancillary kits are included, and we will be back to really trying to have a no wastage model for pediatric doses. But they still continue to say, we really want to take every opportunity to vaccinate. So, okay, vaccine ordering, I'm going to turn it over to Joelle for a few other nuts and bolts about vaccine ordering. Joelle, are you on the call?
Yes, good afternoon, everyone. So just as Miranda was saying, that we did our first rounds of our Pfizer pediatric doses. Those have gone out. They'll be distributed out in the next week. I will be emailing each of the providers who did submit in their requests to double confirm when vaccine will be shipped out and when it'll be delivered. Just as a reminder to everybody that the adult vaccination Pfizer vaccine, the 12 plus, will no ordering will be distributed out directly shipment to providers November 2nd through the 9th. So all orders from this week through next week will not be approved. If you need Pfizer vaccine, you can either submit it through NMSIS and I'll reach out to you, or you can reach out to me directly. I'll put my email in the chat. We will need to utilize all of our vaccine on the ground. We have over 120,000 doses around the state. So as I have reached out to several of you already to have transfers done, we will continue to move through that process this week, next week, and the week of the 9th as well, to be able to utilize all of the vaccine that we have already in inventory. So Moderna and J&J are not affected by the Pfizer pediatric next week. So those ones we can still order as normally. So please continue to submit those into NMSIS. Just as a reminder, we did get clarification around the 20 dose, the extra double of the supplies. Those ones should have already been distributed out this week. So any orders that we submitted after the ACIP vote, you should have plenty of supply for that. And moving forward, you'll have enough for all of those extra doses.
Whoop, we lost you, Joelle. Oh, she might have frozen. Okay, I will, let's wait for her to come back, but this is, so Joelle's going to put her email in the chat. This is also a really good email to include on any communications, because more than one person checks this. So if someone's out of the office, questions kind of all kinds of vaccine type questions do come in through this email, but it was really set up for providers to be able to ask their questions.
Yeah, and Miranda, I guess on that same slide,
Oh.
just to comment that the Moderna is interesting. We heard from CDC yesterday, you know, they're Moderna 14s, they're 14 doses in those vials. So you would think you might get 28 doses if they're half, but they're saying only 20 pokes per vial. So so that's the reason there will be the limit of 20 doses, you know, the half doses, the booster doses in a vial. Now, so I suppose you could get a primary dose out of there that would be whole, but anyway, only 20 pokes in the vial is what they're saying, and the rest will just be wasted. So it's kind of weird.
It is kind of weird. Yeah, we've struggled with that a little bit, but I guess it's a safety, like the number of times you poke a vial is. Okay, well, I think, Joelle, are you back on? Was there anything else on Janssen ordering? I know those supplies have been kind of low in the state.
So yes, I apologize, everyone. We're still having the limited of the 200 doses that you can request. So nothing has changed there. Again, trying to utilize every dose that we have on the ground. So if you do need more doses than 200, I'll go ahead and submit your order in NMSIS, and I will work with you directly to get you the doses that you need, whether that we'll transfer them or we'll kind of do some double orders here. So, you know, please make sure we're utilizing every vaccine that we have on the ground at this time. As far as pediatric Pfizer doses moving forward, those ones will go back out to ordering on November 9th. So please be checking your emails. At our office hours on Thursdays, we'll update you with everything that we possibly have on those and get you moving forward with those orders moving forward. Thank you.
Great, thank you so much. So, and pediatric vaccine ordering will go back to the NMSIS process, right? It was just this initial waves that.
Correct, yes, those ones should be up and moving once we get ACIP votes. Those ones will should start showing up in NMSIS next week for the ordering of the week of the 9th. We can't order anything directly until after the 9th for the 100 doses, but we'll be updating you, and those ones will start showing for direct ordering next week.
Great. Okay, and then I think our last thing is just RTS updates. And I don't know, Chris, if you want to.
Sure. Give a couple updates.
Yeah.
So as of Friday, the Moderna and Johnson & Johnson booster functionality was added as of this morning. The mix and match functionality is available within the app. We're preparing the app for the kiddos ages 5 to 11 moving forward, as well as giving the ability to parents and or guardians to add dependents to their profile so that they can manage multiple folks under a singular profile as opposed to having multiple profiles independent of one another. The majority of these updates are going live tonight and will be available to the public tomorrow morning. However, at this point, in terms of scheduling, mix and match is live and being actively used, and Moderna and Johnson & Johnson boosters are available. We put together a small page on the vaccinenm.org website, which has a small wizard that allows the public to answer just a few questions to determine whether or not they're eligible for a booster. And if they are, then we encourage them to schedule their vaccine. Other than that, app-specific information, online consent for the COVID vaccine is going live today. So if you're a provider using the app and you are using the Department of Health's consent form, individuals from the public will be able to sign that digitally now, which will be helpful. If you're using your own consent form, that online consent will not appear for the public. They will still use your consent form, print it out, and bring it into their appointment, or at least be encouraged to do that when they schedule their appointment. Also, every provider at this point is able to select multiple vaccines on a particular day, that as opposed to limiting it to a singular vaccine, you can identify multiple vaccines. So for example, if you are administering vaccine on Tuesday and it's both Johnson & Johnson and Pfizer, you can select both of those vaccines and it'll appear as such for the public. I believe those are the updates, a lot of updates. If you have any questions, we can absolutely talk through them in the question and answer portion.
Great, thank you. And thanks to everyone on the call for joining and for the huge effort everyone's making on vaccine. I know we're all kind of exhausted at this point, and it's a lot to ramp up on the kid vaccine effort and this kind of complicated booster effort. I think we just remain hopeful that this will really help help squash our numbers, our Delta numbers. So, and make a real impact, save lives in New Mexico. We did hit 5,000 deaths yesterday, which was kind of a sobering moment. So hopefully this provides some hope, even though no doubt it is exhausting. All right, Dan, do you have any, do you have any kind of other updates?
No, not really. I mean, other than that, we're bringing on a contractor to help out with vaccine delivery in each of the regions. We're just getting that started and hoping to kick that off in actual services around the November 9th. So, just another vaccinator in the state with some additional capacity for both some large scale as well as some mobile vaccine clinics. And they'll be, like I said, based in each region. It's Premier Medical Group, which is also doing testing in the schools. So this is another contract for them. And then we're also going to work on them doing some testing. So just trying to make sure we have enough capacity to go around. So that's it.
Okay, folks, I'm going to start reading off the questions from the chat. If you have a question, feel free to raise your hand and or drop it in the chat, and we will address it as we make our way down. Karen Brown asks, does data flow from what we enter into our EMR to, let me try that again. Does data flow from what we enter in our EMR to NMSIS flow into the DOH app if the patient is registered? Can we send mass messages to patients we have vaccinated and are entered in the app and invite to booster events? Are Moderna booster invites being sent out currently? Thank you so much. So Karen, couple questions there. The first is in regards to the data flow from your EMR to NMSIS to the app. The RTS app pushes data to NMSIS, and then what we try to do is take NMSIS out and do the NMSIS data out and do a match against the RTS data. However, it's roughly 70% effective. And so the most important element is to make sure that it gets to NMSIS. In terms of sending out messages for Moderna, that is happening as of this morning, in addition to the mix and match pieces. So if you have a Moderna event, booster event that you need filled, please put in a fill my event request and they will fill it. In regards to messaging the individuals that you have vaccinated previously, there's a couple different ways that you can do that. You can go back to the days that you vaccinated those folks and send a mass message to them using the messaging tool from the location details window, and or I think that's the only way to message those folks in a mass fashion. Does that answer your question?
Yeah, thanks so much. We're trying to figure out how to use, we've got a lot of Moderna that are expiring, you know, within early November. So we're trying to figure out how to efficiently use as much of that as possible. And we're thinking about vaccinating our employees and not putting it in the DOH, just because then it's not double entry. So we're wondering if it would flow. So if we use DOH later, that information would be there.
But we can chat about that. If you can show up to the meeting on Thursday, we can hopefully identify a path forward that makes the most sense. Does that make sense?
Yep, thank you.
Awesome. Tanya writes, I have a person who wants a booster. They received a Pfizer, then went to a site and got a Moderna. Do they get to pick which one for booster, or is there a recommendation on which one to get?
Good question. That situation does get called out also in the guidance, which it never has been before, but they do say basically it's the same choices. If you, again, it's not recommended. There's no mix and match recommendation for the primary series, but we know it's happened, and it can, you know, luckily in this case, luckily in this case, because they're both mRNA, it's going to be at 6 months, and then they would have the choice of the 3 possibilities for a booster: the Pfizer, the Janssen, or the half-dose Moderna.
Tanya, does that answer your question?
It does. I
Awesome.
told him he should go for the trifecta, but we'll see.
I was going to say, yeah.
Okay, great. Guadalupe County Hospital says that Guadalupe County Hospital has about 900 Pfizer on site, ultra low temperature freezer, happy to share with other sites. Joelle, I'm sure you're aware of that, but I would flag that for you. Tanya Lawton again says they sent 3 cc syringes, don't work for 25 vaccinations. Dr. Durham, Dan, want to comment on that?
Well, only I agree. It's hard to drop a small amount in a slightly too big syringe. I guess I don't know. Yeah, Dan, are there? I don't know what options we have.
This is Tanya. I just put it out as for people to know that they said they would be shipping the smaller ones if it was booster. I expected this problem and ordered my own 1 cc and needles, so we're good. But if you're going to be doing Moderna boosters, you might want to have be prepared for that in case they don't fix it.
Yeah. Yeah, it is a pretty small volume.
And Susan, in the same vein, Susan Molina writes, will we be receiving the 1 milliliter syringes with the Moderna? It is easier to draw up the 0.25 ml half doses with the 1 milliliter syringes than with the 3 ml syringes. So I hope that, do you want any further comment here?
Joelle, do you have any insight on whether that's on CDC's radar in terms of what they're sending out?
Unfortunately, when we order, we have no control of what they are going to send us. If you send me kind of some types that you do want to use, I try to bring that up to them and send it to them and say, this is what we're preferred. And usually they go, okay, duly noted. And then they will send us whatever they can. I will continue to try to advocate for those particular ones that you all would like to have included in there. But they just send us whatever supply that they send us. So, but yeah.
Great. Thank you, Joelle. Melinda Templeton writes, I'm sure someone has asked this already and I missed it, but we've had a few clients ask us if we can give them a Pfizer booster and they had received the AstraZeneca vaccine. And I assume the question is this permissible?
You know, I would not swear that it's not in the guidance because you know, there's a lot to get through, but I did not actually encounter that particular situation. And, you know, my guess is that, you know, boosters were approved for the currently FDA authorized vaccines, and AstraZeneca is not one of them. So I think boosters are not authorized for AstraZeneca or any non-FDA approved vaccine. I don't know, Dan or Joelle, have you heard?
Yeah, I
otherwise?
think there was something about WHO approved ones. I think we better get back on that one.
Okay,
Because I think some of the, I think the Russian and the Chinese ones, they weren't accepting, but I think AstraZeneca may have been. So let's get back on that.
okay.
Because that's a really good question. Especially folks coming from Mexico where that's what they're using, I think more.
Yeah. And they just, I mean, this has come up on other calls, but the, you know, there are recommendations for what to do once people get to the United States with an incomplete AstraZeneca. I mean, it does seem like AstraZeneca is the majority of what we see, but with an incomplete, so AstraZeneca is World Health Organization approved. There's 7 of them that are approved by the World Health Organization. It's a 2-dose series. And if someone comes with one, the recommendation is to start over with an FDA authorized or approved vaccine. If they come with a completed AstraZeneca, there's no, you know, then their primary series is complete and there's no recommendation to repeat a primary series. That's in contrast to if you got outside of the United States a non-World Health Organization approved vaccine, then the recommendation is to, you know, even if they completed it, to give one of the FDA, you know, to start over. So, but I don't, you know, I don't know about the boosters.
Thank you, Dan and Miranda. Melinda, we will research and get back to you. We'll send an update and then post this also on the takecarenm.org website in the provider section. Tammy asked Joelle, can we get your email? Joelle responds with her email. If you need that, it's Joelle, there's no taking this back, girl. joelle.jacobs@state.nm.us. It is also in the chat if you need to get it. Please feel free to grab that. Rita writes, I have to hop off, but I've come across individuals in the May booster group, elevated COVID exposure risk at work, who are unable to schedule an appointment for the booster in the system. I'll reach out to Rita and see what's going on there. Most likely something in their profile is prohibiting it. Toby Kessler asks, what is the status of the flu? Great news, everybody. The flu vaccine, the ability to administer flu vaccine in the application will be available for those providers that want to use it. We will be reviewing that on Thursday. Public health offices will have access to it tomorrow, and then we will have a request access on Thursday with a form for the groups that want to do that. So Toby, please make sure that you join us on Thursday. Heather writes, as regards mix and match, I wonder if we should nudge people towards Moderna boosters so that the Pfizer supply can be better protected for kids. Dan, Dr. Durham, would you like to respond?
Yeah, so it is, I think, and I'll let Joelle comment, but I think our Pfizer supply is pretty good. And Pfizer, the pediatric Pfizer is really its own formulation. So it's true that for kids 12 and up, I mean, those are still kids, and they do continue to need to get vaccinated, but I think we have the supply for them. And then for the younger kids, it's just a brand new product, orange cap. So that probably will in certain areas feel limited at first, just because it's been such a huge effort to get, send out this new product to every single vaccinator in the country. But we think we're in pretty good position. Our estimate is that we'll have about 57,000 kids super enthusiastic to get that vaccine and want to jump right on board, and we got 66,000 doses. So we're feeling like that'll probably be okay.
Great. So Heather writes, thanks. So I think that answers the question. Alicia Benavides writes, we have had patients that were given a first dose of Pfizer and second dose of Moderna accidentally. How would we go about with their third dose? Dr. Durham, I believe we answered this. Alicia, do you want us to repeat? Were you here for that, or would you like to hear the answer again? Dr. Durham, why don't you go ahead and respond?
Basically, they can have any of the three choices. It would be 6 months from the second dose, and they would need to be in one of those eligible categories. But yeah, and it is tempting to tell them to get one of all.
The trifecta.
But there's no real, the trifecta. There's no, I mean, it is interesting. CDC stays very neutral about what booster people should get. I think in the news, I've certainly heard a fair amount about well, people should maybe stick with the same brand unless there's a reason. I felt like reading through that, the guidelines that came out, they're kind of like, there doesn't really matter what you do. Or I shouldn't say, they didn't say it that way, but they leave it pretty open for patient choice.
Mhm, mhm.
Great. Alicia, if you need any more guidance, feel free to either hop on or put your question in the chat. Susan Molina asks, vantage points for the Pfizer would be great. The 1 milliliter syringe with the separate needles will work for the Moderna. It helps with separation for the larger pods, as we are drawing up 3 different doses, soon to be 4 different doses once the kids start to come in. Would you guys like to respond?
I will make the note, and I will continue to advocate that that's what the trend is looking for. That particular vaccine, again, can't promise anything that will be changed on that, but I will make sure to note that.
Yeah, and I think just good point that lots of sites have a lot more vaccines going, and that's great, but it is confusing. And so just that attention to safety and taking time, and any visual clue that you can sort of put into place that it's different vaccines, that's kind of what we're focusing on at our vaccine sites.
B. Nichols writes, is NMSIS going to be able to put in 0.25 ml doses for our reconciliations? This week it is not in, and so the reconciliation was off a bit.
So at this time, no, you can't put the 0.25 ml dose in there. We are waiting for some further guidance from CDC. We will be sending you guys out specific instructions on how to complete your reconciliations by Wednesday. So please be looking for your emails. We'll have that updated for you for that. But yeah, at this point, you can't do the half doses. So what you'll do is you'll put the full dose for the administered on there, and then whatever you had to do for the wasted. So making sure that you're putting the full dose in NMSIS for your reconciliation at this time.
Great, thank you, Joelle. B. Nichols, if you need a little bit more guidance, feel free to jump on and or, okay, perfect. She says, thank you. Adela says, is the dilution mix the same for 5 to 11 as the other Pfizer vaccine, 12 to 100 years?
No, it is not. And probably the chart that's in this PowerPoint, which we can even just send out separately, I think is one of the most helpful that I've seen, because it sort of has the comparison volumes. And it, yeah, I'm not going to say the amount because I feel like I'll mess it up. Joelle or Dan, is it
Yeah,
different volume?
It's a third of the volume and,
Or the dilution.
oh, okay.
Yeah,
Not sure.
I think it's 1.3, but again, we'll go back and look, but it is different.
So Adela, it sounds like we're going to get that exact answer over to you here as a follow-up. So if you need clarification or anything, please feel free to hop on and or throw something in the chat. Jason Rice asks, is there a way for us to get more detailed reports in the system, such as a breakdown for how many primary, secondary, and boosters per day per site? Everything that's in there. Jason, perhaps we can chat about this on Thursday. Right now, within the reporting feature, I believe it does break down the first vaccination series. It's not adding the booster, so we can add that in there, as well as vaccine type, since most groups are administering multiple vaccines. But we can look at getting in there and getting a more detailed request on our Thursday meeting, and then a plan to get that developed. Does that sound like a plan? Hopefully.
Yeah, that sounds good. We just have a increase in what they're wanting from us on the National Guard side to be reporting up. So we need to be able to break it down in a more detailed way, specifically for what we're doing at each site.
That sounds good, my man. That sounds good. Well, if you can jump on the Thursday noon call, same link, we'll address it and look at app specific changes. And then Dr. Durham, it seems like you found the guidance here, 1.3 ml for dilution volume for PEDS Pfizer. Is that correct?
That is according to the chart. And again, sort of everything we say about Pfizer is a little bit asterisk, waiting for approval from FDA, but seems like it's unlikely to change.
A follow-up, will you be sending a dilution chart for the new vaccines? Will DOH be doing that?
Yeah, so two things this is reminding me. One is we can send that chart from the slides, and it's in the slides, which will be up on the website. And Joelle, I think once you send out pretty clear instructions once the vaccine gets approved. The other thing is, and I meant to put a slide together about this, Pfizer is having a number of training sessions that I think are just open for everyone to go to, right? Joelle and Dan? So I think we could send those out to people if you want to join. And it's basically people from Pfizer going through the Pfizer information. But I think it's some of my colleagues listened, and it feel like it's helpful just to hear it over and over.
Yeah.
Okay, great. That brings us to the end of the chat. I did just throw the link to the booster updates for providers where we will be uploading the slide deck as well as this recording, or the recording of this meeting. Oh, we have one more. Can we get the PowerPoint in the chat? Dr. Durham, if you can send me the PDF or well, I think at this point we'll post it here right after the meeting on the link that I just sent to you all. That way you all will have the information moving forward. Are there any other questions that need to be answered? Going once, going twice. Okay, Dr. Durham or Dan, would you guys like to close out the meeting?
Well, we're just about ready to get going here on the kids. So ready, set, almost go. So appreciate everybody's efforts and thanks for spending the time to catch up. We got a good participation and we keep trying to answer your questions and thank you so much for asking them. Great job, Miranda. Great job,
Great.
Chris.
Really appreciate everyone being here. Please feel free to reach out with questions, and thanks again for, I mean, just the incredible effort everyone's making to get New Mexico vaccinated.
And great job, Joelle.
Yes, and thank you, Joelle.
Awesome. All right, everybody.
Alrighty.
We'll see you next week. And those that are on the app, we'll see you all on Thursday. Have a great one. We'll talk to you soon. Bye-bye.
Bye.